Welcome to 2025 and our first fireside chat with Surgical Solutions with Betty Casey, our Chief Nursing Officer and Senior Vice President of Clinical Operations. My name is Kirk Leonardelli. I'm the CEO with Surgical Solutions, and we're so thrilled you've chosen to join us today. As we look into our 2025 goals and objectives, it's the perfect time of year to really think about what we all do individually and how that also can directly affect us in our business worlds. If we think about our individual goals and objectives for New Year's, a lot of us think about our fitness and our health personally. We look at the way we might be working out differently. We might look at the different diets that we can go on. The reality is not everybody can do it on their own. And sometimes it takes a partnership. And sometimes we have to look at other ways that we can bring in outside factors to assist us hit those goals and objectives. So as we start talking about the bold moves in healthcare for 2025, we just want to introduce ideas and thoughts that might help someone with how we can drive healthcare forward, really increasing efficiencies, provider and healthcare satisfaction levels, and patient outcomes. So today we're going to begin that conversation. This is an open forum. If anybody has any questions, please feel free to send it out to us in the chats. As we think about 2025, I kind of look back on my career within the healthcare sector, and something drastically has changed the past 5 years. When I started off in the commercial side of the business in the early 2000s, I think back to one of my first experiences walking inside of that scary area that's known as a hospital. So we have hospitals, medical centers, and surgery centers, and in that first days, weeks, and months as a sales rep, a young sales rep, I remember driving up to North Kansas City and sitting in a parking lot for almost 2 hours, trying to get up that courage to walk through those daunting doors and find a way to have a discussion around the services and the offering that I wanted to provide for this organization. At this time, I was working in the surgery area. I carried a bag of hernia mesh that wasn't on a single GPO anywhere. No one knew me. I had no relationships, and I had butterflies going through. But as you think about the old days, as my daughter says, the olden days, you walk in that door, and right there to the left are these older individuals wearing pink, smiling and welcoming you as a volunteer to the hospital. And you could ask them back in the early 2000s where the operating room was. And without question, because there was no vendor credentialing, they would point you down a hallway.
Right.
And I remember walking down that hallway my first time, and I got to the operating doors, and it scared me. And I stared at them, and I was curious on how do I get through? And then they opened because they were automated. And so as someone walked up, they opened, and all of a sudden you're staring straight at 4 or 5 individuals that are reading the board, the holy grail for a young sales rep looking for hernia mesh opportunities. And you're able to sneak in. And you're able to sit down in the surgeon's lounge back then and have a conversation around the products that you're offering. And back in the early 2000s and even into the 2010s, you could have one of 3 areas and be successful. You could have strong relationships, you could have a premium product or service, or you could have a low-cost service that you went through supply chain with that could be pushed into the facility. You only needed one. And on this day, this doctor thought the hernia mesh looked cool and said, "Hey, I have a surgery in 2 hours. Would you like to unpack and put on some scrubs and join me?" And I did. And I watched the healthcare sector take a product from a young sales rep who didn't know what he was doing and utilize it for patient care because it was perceived as a premium product. And I walked out, went to the OR director to get my scrub PO. And back then you were able to get a PO the day of the surgery. And so I grabbed that and I was so thrilled. And I fast forward and think about that experience versus what we do today, Betty. And today that doesn't happen.
Trunk stock.
I can't imagine walking into our facilities now with the regulations and the rules, which are absolutely needed. But something else I learned was back then you only needed one of those 3 areas. And today you need all 3. You have to have strong relationships built on trust. You have to have an elite premium product and offering, and you have to save the hospital's money, real money, hard dollars. And That's a huge change. And it's a massive shift in what I perceive as that partnership between the vendors, the hospitals and medical centers, and the surgery centers. And it is a very challenging needle to thread, but we need to. And we need to have stronger relationships with the people we perceive as partners. And a partnership is a word used way too much. But a partnership, to me, is when both parties are open and transparent and everybody perceives a win and feels a win. And it's something that has to change. The bold moves that we have to see in 2025, we finished a quarter of this century. We have to find a way to do better for the patients and do better for our hospitals that we get the privilege of working with. And the only way to do that is to acknowledge the issues that we're all facing together, which is we have to do more with less and we have to cut our costs. And in order to do that, we have to be more strategic. We have to be more data driven and find stronger and better solutions. As I transition to Betty Casey to have a longer discussion on different areas, I'd be remiss if I didn't talk briefly about who Surgical Solutions truly is, and more importantly, who we're not. Who are we not? We're not a short-term provider. We don't try to come in and put a Band-Aid on something and then disappear. We're not a consulting firm. We're not going to give you a guide, but none of the tools to be able to be successful. We're not a capital equipment manufacturer, although we have very strong partnerships with many capital equipment companies. We're not trying to put a widget inside your facility, then add premium services in the secondary market. And finally for us, we're not a staffing company. And I think that's one of the biggest confusions. We aren't here to bring in staff, because if you think about staff, it got a bad name. Outsourcing and staffing did during the pandemic of 2020, 2021. And I think a lot of facilities are still looking at outsourcing and staffing as a cost center and as a negative. The vendors were taking advantage maybe of the situation some.
Agree.
And so we're very clear that's not who we are. What we do is we come into the facilities and we become a team member at the hospitals. We live in their cities. We use those hospitals, those medical centers. Our families use those hospitals, our friends, and we recommend the organizations we get the privilege of being a part of. And we drive quality, efficiency, and throughput. And we do all of this through a data-driven approach, which is different than anything else in the market. And if we don't think clearly about changing the paradigm, which is what we've been trying to do, and what we'll discuss today, we're missing the mark. We really are missing the mark for our patients and for the future of healthcare. So with that, I'm happy to transition to Betty Casey and have a deeper conversation. Betty.
Thank you very much, Kirk. And I go back when Kirk is reflecting on his memories, and I was that person that was like, no, we're not taking something out of your trunk and putting it inside my patient. So it's kind of funny how times have changed and how, you look at it all together, how we've come together as a team to work more to make sure that our patients get what they need in a timely manner and the quality and everything is there. So thank you for that, Kirk. Going down memory lane was exciting. So I appreciate it for it. And we really are very passionate about what we do. And I appreciate that Kirk has laid out who we're not. I think many times people will talk to you about different partnerships, and the word partner is used quite a lot and loosely. But it does make a difference if your partner is truly your partner, they're with you through good times, bad times. They're very much engaged. They're very much risk shared with you. And they're open to wanting to do things that need to be done for you and your facility, not necessarily what everybody across the world is doing. One size does not fit all, and we know that. One of the things we want to talk about today is we noted, is that everyone does make personal health goals, usually resolutions, whether it's personal or professional. Many of us sit down the first of the year. We start planning it out. And to be honest with you, by the time we get to February, which traditionally I've always thought of as Groundhog's Day, we go back and relive the past and we are back to where we were. It really just takes about 6 weeks to get to that point for it. The people who are successful when they put out resolutions and goals actually are those who have good partners who can come in and help them. And think about your own. If you had a peer, or if you had maybe a coach to help you through your health challenges, or someone to help you with your professional goals, like a coach, or someone you trusted and knew, they're the ones that have helped you be successful in making sure that you made those resolutions and were able to stick to it. We were very privileged this year that we took the time to really talk to our current customers and to some of our new customers and to a lot of our networking peers to really get an idea of what people are and leaders are thinking about in the ecosystem. And you'll hear us refer to that a lot, the ecosystem, because it's not one part of surgical services and one part of procedural areas that really impact. It is the whole system. It's everything from bringing the trays in, cleaning the trays, getting them up to the floors, to the operating rooms, and being able to process and get the patients going. So one of the things we talked about with many of the leaders that we spoke about are what's 7 things that if you could put on your goals and priority list this year, would you want to do for it? And we know there's many other goals. So we try to bucket it together and kind of take a look at it. And this year, we really want to spend some time in understanding what those goals are, who's achieving them, and also what we can do to help support that. So as Kurt said today, this is more of an informal fireside chat to just talk about what's out there and what is top of mind for it. One of the things I want to start out with is what we consider to be goal number 7, and we'll rate them from the goals that are less urgent than the ones that are more urgent or had the least people versus the most people talk about. Optimizing workflow. And Kirk kind of talked a little bit about that when he talked about his own workflow as a new salesperson coming in back many years ago. Really, to be honest with you, is what do you need? What do you walk into? What's going on? What is your throughput? I've been doing this for 35 plus years, and I can tell you the same topics we talked about in the late 80s and 90s are the same topics we're talking about today. First case time starts, turnover time, how many trays are down, do I have everything that I need? Are my pick sheets and preference cards updated? All those topics are still top of mind today. Even though we've been very fortunate to have a lot of new technology, a lot of new software, a lot of opportunities to actually get the intelligence on what we need to do to help us support it, we are still not able to fix it. We still have a lot more work to do to actually solve it. Hence what we talk about ourselves and our word being surgical solutions is that you have to have solutions to solve problems for it. So one of the things that we talk about is what's impacting that workflow for it. I spoke to a customer the other day who has over 100 trays down every morning. They're using their technology, they're leveraging their workforce to be able to match the work, but still they're coming in on having things that are still down, trays that are down. If you come into those situations and you can't get your first cases started, you're already behind the 8th ball and you're struggling, and it's not a good presence for your customers, your surgeons, your anesthesiologists, and the rest of the team, and of course the patients and their families. They're waiting to have a timely start. What I have worked with some of our customers with, and one of the things we're going to really work on this year, is having them go through with a good partner. Again, going back to, do you need a partner, a coach, or someone to go and really just do a CSI investigation on what's really causing those trays to be down and for you not being able to get into the rooms, even though you have the technology to support it for it. So that's what we'll be looking at this year. And we're looking at optimization of workflow for it, because it's not just one thing. It's usually a village of problems that have to be solved to actually create the solution to the problem for it. The second thing that came into top of mind concern is that my equipment is old. My infrastructure is struggling. For those of you who are joining us today live, and for those of you hopefully will watch the podcast later on, we will be in sub-freezing temperatures this week as well as next week, even more severely, more so than back into the last 10 to 15 years. When you come in the morning, many of you will walk into frozen pipes that are actually busted. So we're struggling with the fact that many of our hospitals have lacked infrastructure updating. Many of that's not necessarily the hospital's problem or the leadership problem. Lots of it comes from the permits, the ecosystems of how you have to get sewer and water to your systems. But we are struggling with infrastructure. We are struggling with old equipment. I will tell you that my rounding last year, and I shared this with Kirk, I think I saw very few cart washers that were up and running. Apparently, we all bought it at the same time, and they all went down at the same time for it. But now what I'm seeing is the staff is struggling to do, and ergonomically struggling to clean case carts, because we went to case cart systems knowing we had case cart washers, and now we don't. So the fact is you need to replace those. We're replacing a case cart washers. And for those of you who have already done it or in the process of doing it, is quite a tremendous undertaking. Probably you'd be more easily and successful if you built an apartment building But it does take taking the equipment out, doing a new ditch or, doing a new pit for it. It's a lot of work. It disrupts your day, and it's a high cost for it. So many of our customers and our partners are saying, we're struggling with that. What can we do? The other problem we're seeing is the service. We fail to have good service techs who can come out. There's a skill that's lost. Unfortunately, we don't necessarily teach people how to work on this equipment in community colleges. Mm-hmm. A lot of it is skill that is passed on from generation to generation. And thus, when your washer sterilizers go out, it can be quite a tremendous undertaking to get someone out there to fix it and to have a quality fix. So now you're left with having to decide, do you need to replace it for it? So these are some of the questions that, our partners, and top of the mind for them is that every day they walk into not only their workflow disruption, but also the fact their infrastructure continues to fail them. And what can we do to talk about how we prepare for that? I will say that the number one thing to prepare for it is to ensure that you're following and doing your logs and making sure you're doing your preventive maintenance. We all know that and we all talk about it, but is it actually being done? We count on our staff, and we count on, to be honest, our budgets to be able to support that.
Yep. But Betty, you're mentioning this, but sometimes sterile processing is just forgotten about.
Yes, you're right.
Sometimes the leadership, it's kind of the and guest to the party, and it doesn't get all the resources that are needed to keep it up and running. And yet, as you've shown me, when something goes wrong in sterile processing, it affects some very important departments and very important areas of the hospital.
And not only the operating rooms and the revenue producers, but the SPD also supports those clinics, those outside academic support areas for it. So the emergency rooms, it is the center hub of everything that goes on in hospital settings for it. But, you're exactly right on that. Lots of times they're in the basement. Lots of times they haven't been at the table of the C-suite for it. I'm very excited that in the last 5 to 10 years, I have seen that raise up. There's definitely some strong leadership. We see it every day when we're on some of our social media of people who are out there championing for SPD, but it has not always been that way. Exactly right, Kurt. Bottom of the budget, right? Lots of times for it. The other thing that we have come top of mind that people wanted to talk about really was, the increased case volume and the throughput, all associated again with the equipment and the processes as well as the workflow. But more and more people are aging, having to have more and more procedures. The procedures are very complex. They have a lot more equipment involved. I mean, I go back to the days when we were just doing open appendectomies, then we went to minimally invasive appendectomies, and now we're doing robotic appendectomies for it. So each one of those, increase of technology requires more and more equipment, more and more skill set, much more cleaning processes involved, much more manufacturers' recommendations. Those are some of the items that you have to deal with. The other thing that goes associated with that is we didn't necessarily change the way we did the scheduling. So our block, Kurt and I laugh about that because we talk to many people and even our own partners and customers, and they're like, we're struggling on Tuesdays. Well, when you go back and you look, nobody's using the operating rooms on Friday. Matter of fact, I just had this conversation this week, but yet everybody's piled on Tuesday. And a lot of that just tells us that nobody's gone back to look at block. If you need a block, and if you have blocks, how you need to go back and constantly relook at them and redesign them because the work has changed. Potentially, I could give Kirk a block and he's retired now and doesn't work as hard, and now he's just sitting there holding time. So it's affecting the rest of the operating room by having add-ons and additional cases, which impacts the support staff for it with it. So that's some of the other items that came top of mind. The other thing is just looking at the support staff. Many times these operating rooms are struggling with having people who are, they're doing not at the top of their licensure. I go back to anesthesiologists who are cleaning their own carts. You think how much an anesthesiologist and how hard it is to get anesthesia and CRNAs, and yet we have them supporting, basically task work that could be done by supporting roles that are in the operating rooms.
Sure.
And many of our hospitals that we look at, new customers, really have not looked at their work redesign inside their operating room suites to help support the whole ecosystem for it. So, the top of the mind comes to that is, also staff retention. We live in a very different generation. The work ethics, the different generations working together can be very, very different for it. There's people constantly wanting to poach off your staff as you train them. So training and retraining and holding on to vacancies continue to be an ongoing thing.
And you and I have talked about this. The turnover rate for the staff in sterile processing, operating rooms, and endoscopy is huge. It can be anywhere from 35 to 60% annually.
Right.
And that is something that challenges the hospital at their core.
Yes.
Because if you don't have staff, then to your good point, the healthcare providers, the nurses, the anesthesiologists, the physicians are doing additional tasks that honestly are costing them too much money. Right. And is not what they want to be doing, which decreases their satisfaction levels. So a big part of this is how do we help facilities, right, with their staffing in those really critical areas. It's a hard job.
Yeah.
It's a hard job, and we expect a lot out of them, and they put in a lot of hours.
Yes, they do. And the competition is fierce out there. So just as soon as you get and you feel like you're comfortable with a low vacancy rate, the next thing you know, there's a plethora of people who are leaving to do other things for it, or go and move into other areas. So, being able to support those roles so that everyone feels that they're very valued and that they have support so that they can make those successes in those procedural areas is vital to being able to take that as a top of mind and be able to work on it this year and to be able to make an impact on it for both retention as well as satisfaction.
Yeah, and the straight cost of just recruiting.
Yeah. Oh gosh, tremendous.
So challenging.
So challenging. We'll probably have to have an extra shot of coffee here for it. The third part came in number 3 for us was looking at the control costs and enhancing quality. Budgets are, constantly, as Kirk said and alluded to, you have to do more with less. There's definitely a lot of consulting companies who come in and first thing they look at is where can we cut FTEs, where can we cut the budget. Many times our departments, such as our sterile processing department, are looked at. Basically, a lot of it's because their productivity is still not measured consistently. I was just speaking to a customer the other day where it's measured by OR minutes, which of course, as we all know, is not really associated to what goes on in the SPD. So a recommendation was made to cut more FTEs from there based on an old antiquated way of looking at productivity. Again, we're getting the tools to enhance us with that, but we're not necessarily getting that out to the C-suite. We're not necessarily having a voice at the table. So what can we do to help partners and customers actually get those talking points and actually advocate for them so that they can speak to the senior staff that, we measure productivity different in some of those areas that need to be measured differently for it. And then also being able to make sure that, you do have, the right partner. We have many times people come in as consulting, which is why you heard Kurt, we are very passionate that we don't want to be perceived as consultants. Consultants do a great job of coming in and giving you what's wrong. Unfortunately, they leave you to fix the problems for it. A true partner is giving you what needs to be done or helping you provide solutions that you're integrated with, but they're also standing arm in arm, hand in hand with you to make sure that those successes are there. And that's something you have to think about when you're looking at who is coming in and what are their thoughts and advice and what exactly are they going to do for you? Because basically everybody wants to tell you what to do, but not everybody wants to do it and do it with you. Or think about what you want done. Just because this hospital down the road is doing it this way doesn't necessarily mean it's going to fit into your culture or to the work that you're doing. So I don't know, Kurt, I know you're very passionate about consultants, but, and I am too. So
yeah, but Betty, I am. I think the big thing for me when you think about consulting is there's a role. Yeah. There's an absolute role to come in and help identify and look at processes and ways to improve. But the reality is most of our facilities, especially in sterile processing, don't have the time or resources to fix the problems that are identified. So it's one thing to identify issues, but it's so challenging to our customers when the issues are identified and they don't know how to fix it. Agreed. And they don't know who to tap into. Right. And that's where we come in. And that's where we've had the great success the past couple of years is helping our clinicians and helping our facilities with the issues they know they can't fix on their own.
Absolutely. And what an impact that makes, because you can imagine when the C-suite gets the overall report, they're showing that they're going to have to cut maybe a percentage of the staff, say 15, 20% of the staff. They're going to look at, sometimes those areas that they feel that they could, staff quicker or maybe don't need based on some, erroneous productivity measurements for it. So being able to have a partner who can come in and say, this is what the impact will be on that. And these are some of the solutions that, have been in place and tried, and customers who use it that can give you some of the best practices that can be discovered for it. If you don't do that, then it just becomes a revolving door. And so much money is spent on those lists of things you can do. And to be honest with you, you all know what you need done. You need someone to help you to do it. And I think that's the greatest challenge that we'll see even in this upcoming year.
Mhm.
Another problem was number 2 is achieving the compliance excellence. Every day, we all know we've all been on the different podcasts and webinars and seeing the different chats in our social media. The manufacturers' usage has changed. The IFUOs, of course, are out there and constantly being updated and changed. Standards are being updated and changed. It's almost like every night when you go to bed, you wake up to something new. And that's not to say that that's not the right thing to do. For many years, a lot of what we've done in the ecosystem of surgical service and procedural areas had not necessarily been looked at. And there have been outcomes that are associated, such as hospital-acquired infections, repeat surgeries, certainly death and other things that took place for it. And we should always be at the best because, again, we're caring for someone, including our own loved ones, who really need to have that done. Unfortunately, sometimes, it happens so quickly that by the time you get one process in place and embedded to be done, another one rolls out. So being able to, have that person, that partnership with someone who's up and keeping up with those standards to be able to help implement that change in workflow is vital in the next couple of years, especially starting now, where we're all dealing with just trying to catch up to ST91s and the water quality that's coming out and the many changes going on for it. In addition to that, we do see the fact that, these ongoing changes and stuff are now being, actually, you're looking when they come in through Joint Commission and through DMV, they're actually wanting to see these things in place for it. And, it's important that they're in place because, again, you're doing the right thing for our patients. You're always regulatory ready. But many times, because of the changes taking place, you could be behind the 8th ball. The other thing Joint Commission and some of the regulatory people have been very passionate about this year is to avoid being able to risk assess not having to do certain things. So we do need to be in tune and be with a partner and and make sure your partner, as well as what we do when we go out, make sure that you're doing what needs to be done so that you're not always opting out or doing the right things. They're no longer going to be looking at that. So you guys have already experienced it probably when they come around. They want to make sure jaws of instruments are open. You can't rationalize now why you shouldn't be. So for it. So, more to come with that. And then last but not least, came as the number one thing of concern is really, the customer, the surgeon's environment. And, what we need to do to create that environment, that happy ecosystem that we talk about lots of times, right? One of the things we ask some of our partners and our surgeon customers is kind of what keeps you up at night. It's really interesting to hear their perspective of it. And you can ask anyone in the clinical areas, they're going to tell you the number one thing keeps you up at night is patient outcomes. Everyone's very passionate about doing the right thing, and everybody comes to work wanting to do the right things, but doesn't necessarily mean that the right things are done, that shortcuts aren't taken, and that potentially those outcomes are not there. Also, the life-work balance or the work-life balance that you hear people talk about. The work has become more tedious, the volume is a lot higher, our country is aging as we speak, the technology is keeping people alive longer. And lots of times they're struggling, with, having their own satisfaction of long days, difficult paperwork to be done. The same thing we're seeing as leaders in, these ecosystems of surgery and procedural areas is that we're also struggling with that for it. So, being able to provide support, being able to show some best practices and be able to partner with that. And then, of course, the team dynamics. For it. There's a lot of team issues that go on, especially in small areas like an operating room setting or in the SPD, sterile processing area. You work together, you probably see each other more than you do your family. I think you and I've shared that lots of times. And then you create all this internal confusion that might take place and challenges that take place. And that overflows to all the areas and can cause problems, a lot of finger pointing that takes place out there. So again, these are just 7 of top of mind things that we saw that have impacted, the success of helping teams, as you would your own personal goals with moving forward this year.
Yeah, Betty, I appreciate that. And the reality is, I think all of our hospitals across the country are running into, if not all of these, some of these.
Great.
And it's a constant challenge, and it's something we have to find a way to fix because the patients deserve better outcomes. Our physician providers deserve to have higher levels of satisfaction. And if not, we're going to continue to hurt the healthcare landscape, right? With the expectations of our doctors of what it should be. A bold move for this year that I know we challenge our partners with and our future partners is the term outsourcing.
Oh yeah.
I'm
glad you brought that up. Actually,
stop.
You and I chat a lot about that recently.
So much so. Outsourcing got the bad rap in the late 2010s all the way through the pandemic.
Correct.
And right now we're not fully out of it. Even though to our conversation earlier, EVS is still outsourced significantly. Nutrition is outsourced. But yet, when we talk about outsourcing the surgical ecosystem departments, it's confused and it's not well thought of. And I challenge as a bold move to our future clients to think outside the box. Think about how all these issues have never dissipated away in the past 10, 15, 20 years. They're still there. Maybe there is a way to partner with a company and to look at the way to outsource to hit all three of those areas I talked about when we opened, which is building a trusting relationship with a partner, having an elite service offering, and finally, financially decreasing your operational spend. I've challenged our team this fiscal year that every single client we go into, my challenge is always decrease their operating spend while increasing their elite service offering. And I know you and our teams have been doing that across the country, but I think there's many out there who don't believe that that's even possible. And I challenge them and I challenge us to continue down the path of pushing each other to find out what is possible inside of what we do, to really cast our vision, right, of improving the lives of all those we serve together.
Absolutely. And, Kirk, it's all about innovation, right?
It is.
Thinking out of the box. I mean, people will say that they are innovative and they think out of the box, but the challenge is, can you put pen to paper and can you make it happen? And can you take the challenges of being successful? And maybe you'll be challenged with it and have to go back and regroup for it. But yes, you're exactly right with the outsourcing. It's who you outsource with. We've been doing it for years. We don't talk about it. It's like a dirty little word for it. But, many of our departments many of them have not been done well for it. And people are hesitant to think about that. But when you think about dedicated workforce, that is part of the success. We've seen that in a lot of our customers. And we see a customer hunger for having dedicated workforce. There's also a push going on, too, is that do we centralize sterile processing and do we take it off site for it? And we have been asked many times to come in and look at that as an opportunity for many of our potential customers and customers we have now for it. And I will tell you, it is truly customer dependent. It is also location dependent for whether you want to invest in the bricks and mortar to actually build an offsite central processing area, or whether you could take the concept and innovatively think it out for it, which is what Kurt challenges us with all the time, is think about how you can do it maybe without a building. And that's what we, are thinking about this year. Of many things that we're talking about with our new customers and our potential customers is, again, how can you create a change in those top 7 things innovatively so that you can really fix it with solid solutions and not have to talk about it again next year.
Yeah, Betty, I think the key to the bold moves this year is being willing to think differently.
Agree.
And being willing to look into other opportunities and boldly asking the questions that haven't been asked in the past. And I think if we go down the path of answering through truth, honesty, and conviction, and have the data and the information to back up all of our conversations, I think we're going to see a change in healthcare within the ecosystem of surgery. And I think it's needed. I think the patients deserve it. And I think that our hospitals are longing for some help.
Agree. Totally agree. It's the future of healthcare.
I do. Well, Betty, thank you so much for today.
Yeah,
and
thank you, Kurt.
Hopefully everybody enjoyed a little fireside chat
on a nice cold day.
On a nice ice cold day here out of Overland Park, Kansas. So Betty, thank you so much. Which has
more snow than the Northeast.
Right now we do. Well, thank you very much.
Thank you, guys.